to get started. Thank you everyone for joining us. I'm first going to ask Jody to do a brief introduction.
Thank you, Eric. Hey, everyone. Good morning. I hope everyone is staying safe and well out there. Thank you so much for taking the time to join our webinar this morning. I hope there's not much feedback on my phone. I'm sorry. I just wanted to, again, thank everyone for attending today. You know, this program, I want to commend Eric and his team for the time they've spent in a very short amount of time putting together a response program to obviously what is the most critical need in our state and in our country at this time. It's certainly a priority for Governor Holcomb and Lieutenant Governor Crouch and myself. And so I hope that this is going to be responsive for our communities and it will be useful and impactful moving forward. As Eric's going to discuss, this is an immediate response. So we're also sort of planning and looking ahead for the longer term response. And so that will be more of a coming out here in the future, but this is an immediate response to how we can really help and assist and walk with our communities as we're going through this day by day. So I just want to thank you for what you're doing for your communities. We're all in this together. If you have concerns, questions, ideas for us afterwards, please feel free to raise your hand on the webinar or contact us afterwards. But we look forward to working with everyone through this program. So, Eric, I'll turn it back over to you.
Great. Thanks, Jody. So we're going to go ahead and get started. So this webinar is to go over, as Jody mentioned, our COVID-19 response program under the Community Development Block Grant program. So this is the immediate response, and we'll go over in more detail in a little bit what we mean by that. So we know that right now our rural communities are facing some immediate needs related to COVID-19. And because of that, we have split this program into two areas, the immediate response and then the long-term recovery response. What we are going over today is the immediate response. So as we are talking through everything, you will see timelines such as 3 months or shorter, and the reason for that is to address those immediate concerns. As I mentioned, the funds are coming from the CDBG program, and for this program, we have set up to $250,000 per community. So for each community, we are having a maximum grant amount of $250,000. And again, we are looking at that long-term recovery for the future, and more information will be about that. But again, what we are looking at today is those immediate needs, and we're going to go over what some of those can be under the CDBG program. So first I want to talk about the application process. Since these are very urgent needs and things that need to be done very quickly, OCRA is taking a different approach than what we have done for our other applications and our other programs. We are going to start with what we are calling a letter of need. And that letter of need is an abbreviated kind of collection of items that the community will provide to us, saying that you need our assistance and here's where you think that we can help you. Once that is submitted, then we will assign an OCRA staff member to work with you through the process. Please note that in that letter of need, we will work with you to identify a national objective and eligible activity. At this time, HUD is, we are still having to meet those federal guidelines, but we are working with HUD on a daily basis, and if any of that does change, we will adapt this program to meet those changes. The second phase, once you've submitted a letter of need, we will work with you to complete the application. So in that application, you will be working directly with a community liaison to basically get the details of the activity, make sure everything is eligible, determine the actual grant amount and budget, and submit all the required documents to Okra. Again, we are trying to make sure this is a very responsive program, so we are wanting to work with you to get all of these things as quickly as possible, but also meeting our obligations to HUD of making sure we have everything we need to award grants. And then finally, there's the implementation phase. So the activities must be able to be completed quickly. Again, we are shooting for a 3-month timeline, but we will work with communities on that. And then as you implement the project and activity, we will continue to work with you. Again, this is something where we know the value and importance of these activities to our communities in this time. And so we don't want to, leave communities out there. So we're going to work with you constantly and always be there to help support and guide you through this process as you are accomplishing these activities. With that application process, it goes to the letter of need template. In order to help communities kind of expedite the process, we've created a template that you will complete and submit to us. So this is not something that you have to write up or anything like that. It is more of a kind of a fill in the blank and check the boxes type application. So real quick, I'm going to actually show you that letter. So the first page is a letter. We do need it to be on official letterhead and signed by the chief elected official. As you would see, you enter in the name of your community, your requested amount, and then a brief 3 to 4 sentences about the activity that you want to complete. And then you'll start to see some similarities with our normal applications of the applicant information. But then at the bottom, you see a section where it lists eligible activities and national objectives. These are the eligible activities that we are going to be set up to assist communities with very quickly. There is the other option, which those communities that select that, we will work with you to look at what else is possible with CDBG in responding to COVID-19. Again, a very brief project description and project need, just 1 to 2, 2 to 3 paragraphs of simplified budget. We are not looking for a detailed budget with the letter of need. And then the rest of it really is just the program criteria and the application submission. So a very simplified application for what you normally see with the Community Development Block Grant Program. Once you have submitted the letter of need, we will be checking to make sure that you meet some basic program criteria. We have looked at and worked with HUD to determine what of our criteria we can adjust to make this process as streamlined as possible. So our program criteria is sort of the bare minimum requirement for CDBG programming to ensure compliance with the federal regulations and that we are meeting the needs of the community. So you still must be a non-entitlement local unit of government. You cannot have any unresolved findings or overdue documents. And if you do have those situations, OCRA will work with you to get those addressed as quickly as possible. You still must meet a national objective and eligible activity, which we'll go over here in detail in a little bit. You will have to hold at least 1 public hearing, and that will be before what we call release of funds. And release of funds for us, we are transitioning to where release of funds is really where you're submitting your entire application. And so really at release of funds is where we consider your application submitted. And so that is why we are moving that public hearing. And then we still have to have a second public hearing, but that will not occur until closeout of the grant. So additionally, I want to address the public hearing. We have released guidance saying for any of our public hearings or meetings that are required under CDBG, Those can be done in any method that is approved by the Indiana's Public Access Council. So the Public Access Council has said that they will allow electronic and virtual meetings, provided that the community meets certain criteria. And if you have questions about that, please go to the Public Access Council's website. You can also submit questions to them to get specific guidance for the way you are proposing to do an electronic or virtual meeting. So please don't hesitate to reach out to the Public Access Council. OCRA will accept any method that the Public Access Council approves of. Additionally, as with our regulars, the applicant will have to show capacity to complete the activity. 2 specific points for this program: since this is an immediate response program, we are only looking at activities that are either considered exempt or categorically excluded subject to for environmental review. We will be looking at other activities in the long-range program, but for right now, we are only looking at activities that are either exempt or categorically excluded for environmental review. Additionally, because of this immediate response, we are also only looking at things where the applicant already has achieved site control or it is not an issue. So if you already have a building or something like that that you want to convert, then that is good. But if we're looking at acquiring a building or things like that, that is where we'll have to have further discussions about that because we want this to be the immediate response. But again, we are open to those discussions with that. Some additional program criteria. As I mentioned earlier, OCRA staff will be working with communities throughout the entire process. We are going to be walking along with you through this. This is a little bit different from our normal program. Because this is immediate response and because things are changing daily, we want to have that constant contact with you as communities. We also know that some of you have needs already and that in some cases, doing the grant administration procurement may cause more additional issues for you. So we are making the grant administration optional for this program. Note that does not change anything for our regular program. This is just for this program, and this is to handle the immediate response of that. For administration costs, we are limiting that to 2.5% of the requested grant amount. This is very similar to what we did with disaster recovery. So those are the overview of kind of the program criteria. So now we're going to get into what is eligible under CDBG and what activities can you do. There's 3 main focus areas: public facilities, public services, and economic development. We're going to start with public facilities. So the first activity that we have that is eligible in this program is converting a public building for the use of either testing, diagnosis, or treatment of COVID-19 patients. For the national objective, you will have to have an LMI area benefit, and you can achieve that either via census data, via the HUD mapping tool, or an income survey that is already exists. Now, because of the immediate time and the immediate response of this program, we are looking and would like income surveys that already exist. However, we will work with you if you need to have an income survey completed. But we are really looking for the either census data or income surveys that already exist. The activity itself would be to retrofit or make changes to a building that allow it to be used for the testing, diagnosis, or treatment of COVID-19. So we are talking minor adjustments within the next 2 to 3 months, so very quick turnaround. So this could be things like splitting rooms into smaller rooms with temporary walls, expanding the electrical or other utilities, maybe bringing broadband to that single facility for telemedicine things. There's a lot of different options here of what potentially could be done. But again, we're looking at minor adjustments that can be done very quickly to address the immediate need related to COVID-19. The next activity under public facilities that we are, that's kind of one of the standard activities is rehabilitate a facility to centralize treatment. So this is where the national objective can be either that low to moderate income on an area benefit or a limited clientele benefit. Now, with the limited clientele benefit, that would be where you would either do income intake documentation to verify the income, and so you have a specific set of individuals using the facility, or it could be a presumed class. So you could have a facility specifically for homeless individuals or for senior citizens or any of the other presumed classes. So the activity is primarily focused on the treatment and care of those individuals that tested positive for COVID-19. And this is where, for us it would be you take a building and you're converting it from a prior use. So maybe you have a hotel or school that were closed within the last year to 6 months, and you can very quickly get that back reopened and up and running for this type of facility. Again, the facility needs to focus on a specific group of patients, and we're still looking at minor adjustments to the facility. And the main reason that we are looking at those minor adjustments is related to the environmental review. So for public facilities, there are 2 types of environmental review that we can do. If it is immediate assistance, then that is, we are exempt from the environment, it's considered an exempt environmental review. But that limits what that activity can do. And so for anything that would be considered longer term benefit or have a broader impact on the facility, we would have to go with a categorically excluded subject to review, which takes a little bit longer to be completed. So that's why we are primarily focused on those minor adjustments or temporary changes, but we are open to both and are willing to work with you to determine what is the best way to move forward with your needs. So next we go into eligible activities under public services. Now with public services, we have a 15% regulatory cap on those funds. So there is a possibility that if we get a lot of applications for public services, we are going to have to limit what we can do because of this 15% cap. At this time, Indiana does not have any public services, so we are looking at 15% of our total allocation for fiscal year 19, which gives us a lot of leeway, but we want to point that out just so everyone knows we do have a regulatory limit on what we can do with these. With that, though, the first activity that we can do is provide testing, diagnosis, and other services related to the COVID-19 pandemic. We are looking at national objectives of area benefit or limited clientele again. And this activity could be providing supplies or operations to handle the testing, diagnosis, or other services. It could be in a fixed or mobile location. The big thing here with this one is either everyone in the area is the focus, or you are focusing on a specific group of this. And so when we talk specific group, maybe you are providing supplies or services to a very defined group of individuals that are predominantly low to moderate income. So that is where we could do something like that. So that could be a food pantry or, in the mobile testing center for within a community. Those are all options under this one. Another public service possibility is increase the capacity of your local health services. So this, again, is a national objective of low to moderate area benefit or limited clientele. And basically this idea is bringing outside health services providers to your community. So this could cover salaries or other costs of setting up either a fixed or mobile location for health providers that normally are not within your community to come to your community and provide those testing, diagnosis, or treatment services. Again, we are looking at either doing this for your whole community or focusing on a specific group. And the last public service is establish a delivery service to provide supplies. So this one is very specific to a limited clientele. And basically, we know that there are individuals that are quarantined or those that are medically vulnerable because of their age or they are of that target group for COVID-19. And so they are not able to get and obtain the supplies needed for just basic living. And so your community may want to set up a delivery system or service where you could give those supplies to that group of individuals. And those supplies could include meals or medications or hygiene supplies or really any number of things, basically just to help those individuals stay safe and still be able to have the basic supplies they need to live. Again, this is a limited clientele, so we are looking at a specific group. Maybe your community decides to set up a service focused specifically on the elderly, or maybe you are doing just those individuals that meet the LMI groups for your community. So, this is something that there's a lot of possibilities here, but we think this will meet a lot of needs within some of our rural communities. So those are the three public services. Again, as I'm going through these activities, these are the ones that we know are eligible and that we're set up and ready to move forward with, and they are exempt and things like that. But we are not limited just to these activities I'm highlighted. So if you have other activities, please don't hesitate to reach out to us and talk about those other ideas. So the third set of eligible activities are economic development activities. And these are activities to basically help us get through the immediate time and help our local businesses possibly reopen once we are past this, the stay-at-home order and things like that. So this is under a national objective of LMI job retention. This is a national objective Indiana has not traditionally done, but we are opening it up because of these, the situation, and because we know this is a major need within our rural communities. So with LMI job retention, at least 51% of the jobs that are being retained must be held by an LMI person. And so there is some income verification and things like that that would need to be done by the business. And then we would have to also document that the jobs would be lost if not for CDBG assistance. And again, we'll work with you on determining that and the businesses. The purpose of these is not that you have identified the businesses when you come to us, but we'll work with you to set the program up and then identify the businesses that would be assisted by this program as we're working through that application. So for this activity, they would cover things such as working capital, continued operations, and then support from remote work. So again, this is to help your businesses in your community survive the economic impact currently being felt by due to the COVID-19 pandemic. Please note we are looking at long-term economic recovery, and that is part of our long-term program. So the first one was grants to businesses to retain LMI jobs. In some of our communities, they may have the ability to and set up to do loans to your businesses. The same thing applies for the LMI job retention. 51% of the jobs must be held by LMI persons, and then we need documentation. Again, it goes for the same thing: working capital, continued business operations, and support for remote work. The big thing with this, though, is we have a couple of requirements. First, we are requiring that communities that are interested in loans either have a revolving loan fund already set up or have a similar financial instrument already set up that it could be used for a way to distribute the loans and manage the loans for your community. Any loans that are done out of this program must be at a 0% interest. They can be forgivable if the business met certain requirements. So that is also something that is possible. So again, for most communities, we think that the grant program is going to be, where they want to go for the immediate part. But some communities may want to do the loans, and long term, the loans could be what we are looking at more. But again, more information will be coming out about our long-term program in the future. So those are the three main areas that we're looking at and the activities that we're looking at underneath that. Again, this is what we know we have everything in place for, but we are open to other ideas. So just because you didn't see something, one of the activities that could benefit your community, please still reach out to us because we could potentially help you with something else. And when I say reach out to us, you're the best point of contact for any community is going to be your community liaison. And so we have our community liaison regions. For the Northeast, please note that Andrea is still out on leave, and so Christmas is filling in for her. But please contact your community liaison, and they will be there to help and assist you throughout this process. Again, we want to walk alongside with you as you are getting these immediate needs addressed within your community. So with that, we will open it up to questions. To handle questions today, because we have a large group of people, we are going to ask those individuals that want to that have a question to use the raise hand function. To access that raise hand function, look at the bottom right-hand corner of your screen, and you see what looks like a little hand in a box. If you click on that, that will raise your hand for us to see that, and then we will be able to call on you. For those individuals that just joined by phone, unfortunately, we will not, that feature is not available, so we will not be able to take your questions at this time, but please reach out to your community liaison with your question. So it looks like we have a question from Aaron Crow. Aaron, we are going to unmute you in just a moment. And I think, Aaron, you are unmuted. What's your question?
Hi, Eric. So just a quick question. Do you, have any thoughts on how engineering firms can help some of these communities with the projects you described?
Yeah, so I think there's a lot of different ways engineering firms could potentially help with this process. With the public facilities, it could be working with the community to get a very quick estimate done of the work needed or get plans quickly drawn up. and so for immediate needs, that's kind of for the immediate needs. But long-term needs, this would also be a good time to start talking with communities about their long-term needs, where they may need some of those, items from engineering firms that take a longer time, such as a preliminary engineering report or something like that. So I think this is one of those things where everyone possibly has a role, and it's just going to be dependent on the needs of the various communities that we work with. And so next, it looks like we have a question from Janet Rummel. And Janet, you are unmuted.
Okay. Thank you. For the delivery service to provide supplies, can funding be used to purchase the supplies themselves?
Yes. Now, we would have to look at the details of what those supplies are and things like that, but supplies are an option.
Thank you.
So are there any other questions? I'm not seeing any other raised hands. Nick Creevy. Nick,
Eric, I was wondering if any of the normal restrictions on open CDBG projects would be applicable for these.
No, there is no we've removed that restriction. So if a community has the 2 or 3 grants open, this is viewed as separate. So that requirement is, or that policy is not applicable to this program. And it looks like we have another hand from Cheryl. Cheryl, you're unmuted.
Thank you. I just need to know if Vanderburgh County is eligible for these funds. I think that normally CDBG funds not share with outside city limits.
So we have 2 entitlement counties in the state. Hamilton and Lake. So Vanderburgh is not one, but you have an entitlement city within your county. And so as long as it is outside of the entitlement that is in your county, you are eligible for these funds. So any other questions? We presented a lot of information today, and I know there's a lot to digest. After this webinar is done, we will be sending out an email to all attendees and a broader announcement to all of our stakeholders with a link to our COVID-19 response program website. On that website, you will find the PowerPoint from today. You will also find the letter of need template, and we will be posting the recording of this webinar on that website once available. And it looks like we have one more question. Jeannie?
Yeah, hi Eric. This is Jenny Monroe. I just wondered if communities that are currently implementing a stellar plan would be eligible.
That's a good question, and that is not something we have discussed yet. So I will have to talk with Jody and Matt Crouch and Michael Sinnott about that, and we will get back with you very shortly.
Thank you.
So I am not seeing any other questions. Thank you, everyone, very much for attending. I hope and look forward to seeing your letters of needs and working with many of you on grants for this. Again, this is just our immediate response, and we will be having a long-term response in the future. Matt or Jody, would you like to say anything to wrap up?
Well, Eric, again, I just want to thank you and your team, and I want to thank everyone on the call for all that you're doing for your communities. Again, we want to walk through this with you together. You know, Eric's presented some great ideas today, but if you have other thoughts for us, please don't hesitate to contact me, Eric, his staff, Matt, whomever you might most frequently speak with. So thank you so much, and we appreciate it. We look forward to working with you. Stay safe, everybody.
Thank you, everyone. Have a great day.